Hi, I'm Dr. Bhavesh Vajifdar. I'm a cardiologist at Lilavati Hospital, Mumbai, and I specialize in doing complex angioplasties. Cholesterol is something which does not, give a problem immediately. It's like if you have a sink in the kitchen and you are putting some dirt every day there, and finally one fine day it gets clogged. So the clogging happens on that day, but the problems have started quite before. So similarly, the high cholesterol which is flowing in the blood vessels of the body and the heart, they tend to deposit on the walls of the heart, and that gradually worsens, and the space for the blood to flow in the artery reduces. So you should not wait for achieving that kind of a blockage before you start treatment. So it's better that you measure your blood levels of cholesterol prior and then start treating, so that you prevent the deposition of cholesterol in the arteries. So we should understand that the medicines which we take for high blood pressure or for high blood sugar, they are not curative medicines. They just control the levels of blood sugar and blood pressure. And if you stop them when they are in good levels, then the chances are very high that the levels of blood pressure and your blood sugars are going to go very high. And if they go high, they can have a rebound problem and you can develop problems and complications. When you get a symptom of a heart problem, when you get a chest pain or a heart attack or a breathlessness, this is not the beginning of the disease. Unless you do a regular checkup, we may not know that you have this problem, and hence it is very important that we do regular checkups. And when we know that we have some risk factors which can lead to a heart problem, it's best to try and treat them and not wait for problems to occur before we start treating. So pre-diabetes and pre-hypertension, as the word suggests, are conditions where you are not actually above the threshold which is needed to diagnose you as having high blood pressure or having high blood sugar and diabetes. But you are a little bit above what normal people have. And when you are at that level, the most important thing is, if you do not take care, then there is a very high chance that you will end up being into a proper hypertension or proper diabetes. If you have this pre-hypertension or pre-diabetes, and if you diagnose them, and if you try to control these by lifestyle modifications, then you can reduce the speed of progression into a full-fledged disease, and at some times you can even halt your progression, and you may kind of remain non-diabetic, non-hypertensive if you have taken the proper precautions. What you mean by Heart Strong India is when people will stop getting heart diseases, not only when they are old, but especially when they are young. Because now we see a lot of young people developing heart problems. The general people are not aware of what causes heart problems, of what can we do to prevent getting a heart problem. And so education and awareness is the most important thing for a Heart Strong India. To be heart strong as a nation, we need to prevent. And to prevent, we need to educate, we need to make people aware, and the people should understand what is the problem and take positive steps to try and avoid heart disease.